Hello, my name is Jessie Cho, and this is my public health presentation called Preventing Dementia. Dementia refers to a variety of conditions and diseases related to cognition, the overwhelming majority of which occurs among the elderly 65 years of age and older. However, the World Health Organization calls dementia a syndrome, which means that it's not a normal part of aging. There are 100 billion nerve cells in the adult brain, and there are these branching extensions called synapses that connect to other neurons. There are 100 trillion of these synapses that allow signals to create thoughts and sensations and emotions and movement and skills and so on. So what happens with dementia is when these neurons degenerate or die, nerve cells do not regenerate. Thus there is no known cure for dementia. So my intervention program is designed to be both widely understandable and accessible to urban American populations regardless of income, education, or availability of health insurance. So I just want to quote Ralph de Clemente here, who says that the greatest priority in public health is for nations to prioritize prevention over treatment, and that social equity must become a frontline effort of health promotion programs. So though the current movement in public health since the 1970s places a greater emphasis on environmental and social factors, among the most cited research articles that I saw, only the following two mention the cost of tertiary intervention for dementia. So Brookmeyer and his colleagues stated that the high level of care basically means that 24-hour nursing home care, and that most American retirees just cannot afford it. And Tyson Bleiler, a few years later, quantified this stating that in 2010, half of all Medicare beneficiaries in the United States had a total savings of about $55,000 or less. And that amount represents less than a year of nursing home care. So both of these major reports point out the utter unaffordability of tertiary care for Alzheimer's and dementia. So up above here you see these most cited research reports, and these medical researchers unanimously agree that there is a close correlation between cardiovascular and neurological health, and that primary prevention measures that support the heart and brain must occur by at least middle age. So my program and theory, for that reason, targets middle-aged people who are at high risk of dementia, and high risk is defined as populations with high stress and or low physical activity who work 30+ sedentary hours, and that's a large sector of the workers of urban America. And my references are Chicago and they're working adults, as you'll see in my program. The only reason I point out the urban Americans is because it's just an urban bias on my part. It has nothing to do with prevalence of dementia. Okay, so my multimodal program involves the top 3 primary prevention interventions that are universally agreed upon by medical researchers, and that's diet, exercise, and cognitive training. The 2 theories that I'll apply here is the trans-theoretical model of change, stage theory, and the structural model of health behavior. So first, we're going to get to diet. So we're locating the interventions, the diet interventions at the kitchen table, so to speak, and that translates to, in my program, the cafeteria at work, with an emphasis on sustainability for people and the planet. So my program involves a free breakfast where the cafeteria at work opens from 7 a.m. to 9 a.m. every morning, and that's to encourage people to have a healthy breakfast. They come to work, they pick up a breakfast bowl that basically is filled with hot oatmeal, and they have the option of adding ground nuts and fruit. Coffee and tea, like most workplaces, are freely available near their workstations, and near their workstations at the same area is a sink for people to wash their own mugs and bowls, and these bowls can be dropped off in the cafeteria at lunchtime or any part of the day. So I liked the Northeastern Goldilocks model, where for my program, the employees can use their employee ID to just, scan in, and breakfast is free, but that Goldilocks model is useful for cost and use measurements, and also as a possible incentive programs. So as for the costs involved in offering a free breakfast, oatmeal is cheap, and you could argue that it reduces company health insurance costs, and in the long run, healthy employees results in sustained productivity throughout the day, et cetera, if they need that. So the diet program, let's get to lunch. Again, using the Goldilocks model, so it's like prepaid and it's tax-free when they scan. The cafeteria offers no fried foods, no genetically modified foods, no high fructose corn syrup, and no prepackaged foods like chips or cookies. There's freshly baked chips or sweet, fruit sweetened pastries available. But if they want any of this junk food, it's widely available across America, but just not in this program, in this healthy culture of work. So the work cafeteria offers every day a different whole hot plant-based plate of food that has like the protein is fish, a small side of fish. And there's always a fresh salad bar available with legumes and ethnic foods. Again, using the Northeastern model, I know because I saw kimchi in there, and I was like, yay! It's really cool. It's like a multi-ethnic food model, and also there are fermented sides. Fermentation is like good for the gut as well as good for the brain, etc. So the diet program also, there's a knowledge building aspect of the diet program, which is like just like in the Northeastern cafeteria, there's like a screen where you look at stuff while your food is being cooked, and on that screen in the cafeteria, there's a full disclosure of the ingredient, no high fructose corn syrup and so on, and emphasizing little tiny infomercials relating the importance of diet and heart and brain health. And every Monday at lunchtime at 1 o'clock, there would be a lunch presentation delivered by nutritionists and medical professionals who emphasize the diet, heart, and brain health triangle. And these presentations can be filmed and uploaded onto the company website for any of the employees to watch at their leisure. Okay, so the diet program also involves on Fridays, right before the weekend, there would be like a cooking demonstration. So at lunchtime, the nutritionists and professional cooks could like actually have a cooking demo that lasts 10 minutes. It's a condensed 10 minutes thing with using pre-cooked foods, just like in the cooking shows on TV, and emphasizing easy heart and brain health meals, and the ingredients would always be foods in season that could be easily found at low prices at their local grocery stores. And whoever comes, the employee participants who come, they get to taste the meals that they just saw a demo for, and they get a free lunch. So, and of course the recipes would then be uploaded on the company website as well. So the theories that's informing my diet program, the TMC stage theory has 5 stages, as we know, and my program really emphasizes the latter 3, because many middle-aged people may not be eating for their brain, but most people are aware that their diet has a direct relation to the health of their heart. So the first 2 stages can be skipped, and everything else is kind of like done, prepared for you. The action would be like if they just go to the cafeteria and eat, and it would be maintained because, like I said, it's partly you're developing a culture, a healthy work culture. So the structural model of health behavior, there are 4 categories critical in shaping the health behaviors. And my intervention program is really strong on availability and accessibility, and like I said, using the company website as the media and email and cultural influences. It's a cultural, it's again creating a healthy culture at work that kind of ideally spills over into their home lives. The challenge here is really the physical structures and the social structures and policy, because you need the space, you need a cafeteria, you need the Goldilocks, you need the screen. But like I said, that can be argued with the company where there's a will, so the productivity and cost effectiveness of all of that. So the second aspect is exercise. And my intervention program would involve divvy vouchers to encourage people to bicycle to work, and to encourage local meetings with other employees who live closer to you. Again, encouraging people to bike to these meetings, to have smaller kind of like regional affinity groups to discuss like policies or what have you, and then followed by broader virtual meetings company-wide. And twice every day of the work week, there would be programmed breaks where there would be 15 minutes of guided movements in the matted rooms at 10 a.m. and 3 p.m. and 15 minutes before each of those twice daily sessions, there would be like a little ding at your computer to remind you to, like, just go take a walk or something. So the exercise program, again, exercise is kind of a no-brainer for middle-aged people. So the pre-contemplation, the contemplation, we can skip that again. But again, everything is kind of like prepared and done for you and set up for you. And it becomes part of an incentivized exercise program. It becomes part of the flow of the workday. All right, so as far as a structural model of health behavior, the strength, again, is the availability, accessibility, the social structures and policies in place, the development of that healthy work culture, utilizing the company website as the media. Again, but you do need the physical structure. You do need the room with the multi-purpose room with the matted floor. But again, that could be well argued with the company. The last part is the cognitive training. So the earliest symptoms of dementia is difficulty remembering newly learned information, and eventually the brain's ability to metabolize glucose degenerates, and then it leads to more profound problems like motor skills and difficulties swallowing. But for middle-aged people at work who are working, my training program will involve memory exercises, computer pop-ups at 12 o'clock every day. They could just close it if they're busy or something, but every day. And then 8 a.m. every morning, there's a 20-minute meditation session with MBSR using mindfulness exercises, mindfulness-based stress reduction exercises, and they're guided on Tuesdays and Thursdays. The Wednesday lunch presentation would be facilitated by an MBSR professional, and again, uploaded on the company website. So the TMC stage theory, because the cognitive training more directly intervenes to prevent cognitive decline, this aspect of the health program may need to transition people a bit more between the pre-contemplation stage, where they know that dementia is out there and it affects like some old people, and to the contemplation stage where they understand that adjustments they make now as middle-aged professionals, people will have significant effects later on. But again, it's like set up, it's part of the workday, and it helps them to maintain this action. So thankfully, cognitive exercises can be done anywhere, so no physical structures are not such an issue, though Wednesday lunch presentations would still need that large cafeteria presentation and eating space. So there are a great number of MBSR facilitators that would be cost effective. All right, so here is the workflow week for my multimodal program. My face is covering part of it, so this screen is repeated at the end. I do want to end by saying that at the beginning of my presentation, I referred to the cost of medical care, and I also quoted De Clemente regarding social equity. The only resolution in Congress that currently proposes such an outcome is the Green New Deal, tying the ecological crisis to economic and health declines. And I just want to close by saying that no matter how theoretically sound a health program is, these structural determinants have to be radically reconfigured for any broad-based health program to be successful. And this is in keeping with contemporary theoretical developments. Thank you very much. Following is my bibliography and such. Thanks, bye.